The following video provides a product walkthrough and quick setup of the Aero temporary pacing catheter. This information is provided for clinical education purposes and is not intended to be a substitute for sound clinical judgment or decision-making or professional experience relative to diagnostic and treatment options of a specific patient's medical condition. Refer to instructions for use provided with the product for complete warnings, indications, contraindications, precautions, potential complications, and instructions for use. Kits and sets may not contain all accessory components detailed in these instructions for use. Become familiar with instructions for individual components before beginning the actual procedure. The Aero balloon temporary pacing catheter is indicated for use in temporary transvenous ventricular cardiac pacing when impulse formation or conduction is impaired. Welcome to the Aero temporary pacing kit product overview and quick setup video. In this video, we will walk through the pacing kit contents and provide a brief product overview. Catheters or complete catheter insertion kits are available in 5 or 6 French and in flotation or torque-directed configurations. Procedural items needed for insertion of the bipolar pacing catheters are included in the kit. The contents include a suggested procedure for connecting the shrouded pins to the cable from the pulse generator using the 2 mm reusable pins, 3 ml orange-tinted ChloraPrep device, and instructions for use. 24-inch by 36-inch drape with 4-inch fenestration. Temporary pacing catheter, 5 French, 110 cm bipolar balloon. Reusable 2 mm socketed pin adapters. 24-inch by 36-inch drape. 6 French Aero Flex sheath. .035-inch, 45 cm stainless steel guide wire with the Aero Advancer. Catheter over needle, 20 gauge by 2.5-inch catheter. 22 gauge by 1.5-inch injection needle. 25 gauge by 1-inch injection needle. 18 gauge by 2.5-inch introducer needle. A 3 ml Lure Lock syringe, 2 5 ml Lure Slip syringes, 0.75 control stroke syringe, 5 ml 1% lidocaine HCl solution, a TUI-Borst adapter, dust cap non-vented, Cathguard contamination shield with attached TUI-Borst adapter, alligator clip, scalpel, 3-way high-flow stopcock, 2 2-inch by 2-inch gauze pads, and 5 4-inch by 4-inch gauze pads. Silk suture with straight needle. There are 2 options available for catheter configuration. One is a torque-directed catheter, and the other is a flotation catheter with a balloon at the distal end of the catheter to allow flotation of the catheter through the right atrium and into the right ventricle. The catheter is tapered underneath the sleeve to ensure that the deflated sleeve does not exceed the external diameter of the catheter. The temporary pacing catheter is a radiopaque polymeric catheter with length markings printed every 10 centimeters. It is available with 2 configurations with bipolar platinum electrodes located at the tip and a second platinum electrode at either 1.5 cm or 2.5 cm. The negative electrode jack marked D for distal must be connected to a negative terminal of an external pulse generator. The positive electrode jack marked P for proximal must be connected to a positive terminal of an external pulse generator. The proximal end of the catheter includes 2 recessed shrouded electrical connectors which mate directly to most pulse generators and are identified on their connecting cords according to electrode position. Reusable 2 mm socketed pin adapters are included to be used as needed. The catheter kit includes 2 TUI-Borst adapters designed to hold the catheter in place after insertion and after being placed into position. Assembly of the catheter prior to insertion includes positioning the sterile sleeve with the TUI-Borst end going on first and ending up most distal to the insertion site. After the sterile repositioning sleeve, a single TUI Borst is placed on next with a sheath locking mechanism nearest the sheath hub. To aid in placement, the included alligator clip may be used to attach the distal lead of the pacing catheter to the V-lead of an isolated ECG. Recommended insertion sites: internal jugular vein, subclavian vein, brachial vein, femoral vein. Position the pacing catheter into the trabeculae of the right ventricle. Attach the catheter to the pulse generator and observe for 1-to-1 capture. Once capture is determined to be correct, advance the TUI Borst adapter onto the sheath, bring the sterile repositioning sleeve onto the TUI Borst end, and rotate it in a clockwise fashion until the TUI Borst adapter clamps down onto the catheter. Extend the repositioning sleeve and tighten the TUI Borst down distal to the insertion site. Refer to the instructions for use for cautions and descriptions of insertion.